Let's say I've decided on which route I'm going, lumpectomy versus mastectomy. What are my options for the reconstruction?
Yeah, so lumpectomy is a different category. If we're talking about just mastectomy reconstruction, the spiel that I would give in a consult is there's two camps when it comes to breast reconstruction. I can use tissue expanders and breast implants, or I can use your own tissue. And in certain situations, we bring those together for what we call a hybrid reconstruction. So if I'm going to use implants, my preference is to go direct to implant. So I don't like to put in a tissue expander if I don't have to, because I like to remove that from the patient experience. Direct to implant is a unique skill set. Don't push your surgeon to do something that they're not comfortable with. Find a surgeon who's really good at it and already does it and is comfortable doing it, and ask them to do it. The other camp is using your own tissue, and that's where you get the deep flaps. And where the tissue comes from is dependent on two things. One is your surgeon, a really, really good microsurgeon that's comfortable with doing all these flaps. A lot of them, the majority of them, only do deep flaps. And then the second one is, where do you carry your weight? Are you someone who happens to carry it in your tummy or your love handle or your thigh? And we can make accommodations based on that. If you are not going to need radiation, then generally speaking, you're a good candidate for either or. If you need radiation or have had radiation, flaps are generally a superior option to implants. The times we would bring them together as a hybrid would be if someone doesn't have enough tissue to be the size that they want.